Support for Radio Friends comes from IT Como, offering computer and IT services for small businesses and residential clients. IT Como can set up remote work-at-home solutions and data security and backup systems and upgrade your company email to more modern platforms. IT Como can also help you get the most from your technology at home. Learn more at itcomo.com. Good morning and welcome to Radio Friends on Friday, December the 9th. We're going to talk about the cold weather and how to stay healthy in the cold wintertime. And I want to introduce you to Dr. Satish Kalonjeri and Dr. Jeremy Johnson, both from the VA hospital. Pleasure having both of you here.
Thank you. Hi, Paul.
Cold weather, that's the flu season. It's the cold season, and you can pick up a better chance of picking up COVID again, whether you've had a vaccination or not, even though if you get it, it's going to be milder. What do you say? What's the precautions we need to take during wintertime?
Well, Paul, you're absolutely right. Cold weather can cause an increase in the number of respiratory symptoms that we notice, and your observation has been backed up by studies. There are studies that indicate that even with a drop in 2 degrees centigrade from what is baseline temperature for a place, the hospitalization rate can go up to as far up by 3 or 4%.
Really? And why is that?
Well, that is because cold air is a little different from warm air. Cold air, just because of its lower temperatures and because it's drier than warm air, can have an effect on the mucosa, the breathing tract, the airways, and so on. So it can damage the airways, cause inflammation. So this in itself causes people to have what's called bronchospasm, narrowing of their breathing tubes. It makes them susceptible to getting infections such as flu, COVID, or even pneumonia. And therefore, these symptoms are higher during winter months, and therefore the need to take some precautions.
So what you're saying is breathing the cold air actually makes you more susceptible to getting sick.
It may, yeah. For sure it can lead to bronchospasm or airway narrowing, and that's bad for people with asthma or COPD because it can cause flare-up and exacerbations. But we know that people that have no lung trouble can sometimes get short of breath when they exercise or do something briskly out in the outdoor
in the cold weather.
Yeah,
right.
And we think that it can damage the lining, what's called the mucosa of the upper airway and the lower airway. And this may cause inflammation. And this is all about defense mechanism from the hair in our nose that helps block viruses and bacteria when we breathe in, to the lining of the lung and the airways that help with preventing illness. And so if that's damaged, then yes, we think that maybe you're more susceptible in the cold, in the wintertime, for infections, viral infections, lung infections.
Now, you talk about the cold damaging it. Is it permanent damage or only temporary damage when you're breathing that cold air in?
Right. I mean, it seems to be temporary. I mean, it happens with the cold, and we're not, we have different times of years, different time of weather when we're not as susceptible. Mm-hmm. Now, in addition to that, when it's cold, then we all tend to gather inside. We go outside less. And so then we huddle in groups, or people, there's more crowding in indoor malls and shopping places and at home. And so then whatever other people have, then we're susceptible to. And that's why distancing with COVID, how we 6 feet distanced and how we used masks, I mean, that helped reduce things. But for sure, the cold weather can cause inflammation and changes in our mucosa that's temporary and can make us more prone to infections.
So are you recommending that we continue wearing masks when we're in crowded situations?
Well, ideally, that's going to help. I mean, it's going to help prevent. When I wear a mask, I help keep my secretions close to me and less of a risk to reach you that you're going to inhale. And so if I'm sick, then that's beneficial. If we knew everybody that was sick and the people that were sick in the room had masks on, then that'd be great. But we don't know who all is sick and who's not sick. So masking is helpful, but I don't know that it always has to be 100%. But it's for sure helpful and will be helpful, especially in wintertime when we're in close gathering. Because, like you said, COVID, flu, influenza, RSV, all these viruses that are easily spreadable through respiratory secretions and breathing.
Right. So the thing that we need to keep in mind is be mindful about the way we were acting when the pandemic first started. When the pandemic first began, we were wearing masks. We were staying 6 feet away from people. We were trying to avoid being in large crowds, and we've kind of let our guards down with that. You're not saying we have to go back exactly that way, but be cognizant about what you're doing. And if you can wear a mask when you're in a group of a lot of people, wear that mask. Yeah.
Correct. And that's absolutely right. Because what we noticed during the pandemic is we wore masks to mitigate the effects of the COVID virus. But what we found out is that over the last 2 winter seasons, the number of flu-related admissions went down dramatically.
And so did colds.
So did colds. And now it's making a resurgence. And what we don't know is how bad the flu season is going to be this year.
Yeah.
But we already know in kids and in children, the RSV virus is wreaking havoc. And therefore, without getting paranoid about masking, if we have a sensible masking practice, so the way that Dr. Johnson mentioned, when you know you're going to be with a group of people and you don't know what they have, it doesn't hurt you to have a mask on.
Well, I tell you, just personal myself, when the pandemic started, of course, we all wore masks. And I wore masks. I kept 6 feet away. Many of us were in isolation. I went 2.5 years. I didn't have a cold.
Yes.
I didn't catch the flu. Yep. And that was the first 2 winters that I can ever remember that I didn't even have a cold. And the only way I can attribute that to is the fact that we were wearing a mask.
Yep. So you've just done a great observational study and validated
right.
why it's very helpful. Yeah.
Then we kind of let our guard down. Yep. I was bragging. 2.5 years. I haven't had COVID. Doggone, back in September, I got COVID. I'd had my shots, and thank God it was a mild case of COVID. I think if I hadn't had my shots with my asthma, I could have been in the hospital and one of those people being intubed.
For sure.
For sure. So it's important to stay up to date on your vaccines.
Very true. Sorry to hear that you had COVID. But I think you bring up a great point. One reason why you had mild symptoms, or a few reasons why you had mild symptoms, were because you had good social distancing practice. You used to wear masks before, and you were up to date with vaccinations.
Yeah.
And so this winter, what we suggest is people get their flu shots, their COVID boosters, and eligible patients with pneumonia who are eligible for pneumonia vaccinations get them, and be sensible about heating inside, and don't exercise outside, stay inside and exercise and so on.
Thank you, doctors. We are out of time, but I appreciate you coming by so much.
Great.
All right?
Thank you, Paul.
You can check out more information at the VA hospital. Drop me an email, pepperp@missouri.edu. Bye-bye.